For Save the Gonads X-ray shields, the correct size and placement of the shield is vital to its success at blocking radiation to the gonads. For infection control reasons, the shield is meant for individual patient use only. The shield may be reused for a single patient. The shield is 99.9% lead and is encased in a soft satin covering that will not harm the fragile skin of the baby. It is not recommended to place the shield in plastic, since plastic may cause harm to the baby. The correct size is determined by the weight of the baby. The sizes are newborn, preemie, micropreemie, and nanopreemie. Shields that are too large may block areas that are needed for the diagnostic X-ray, or may cause harm due to its weight. Shields that are too small won't properly cover the gonads. To eliminate risk, choose the correct size and placement accurately for the baby. For females, the lobes of the heart should be facing upwards to cover the ovaries. The shields can be flexed and fitted into any shape with placement at the iliac crest of the pelvis. The shield should be held in accurate placement by a trained nurse or technician. If the shield becomes soiled, it is easily cleansed with alcohol and dries within 30 seconds, ready for the next use for that patient. The sizing and placement for males is almost the same. The only difference is that the lobes of the heart should be facing downwards to cover the testicles. Once again, the shield should be held in place by a qualified nurse or technician. When used properly, Save the Gonads shield significantly reduces radiation exposure to the gonads. It is a tool only to be used by qualified medical personnel.